Good morning. Remember, breathe. Check for signs of dry cough, fever, and shortness of breath. The fever is 100.4. And step back. Also remember to check on your family members. Call your mom, call your grandma, call your granddad, call your family members and anyone you love to make sure that they're okay. Check your surroundings and always check your sources. Now, what I want to talk about is it's a term that you're going to be hearing. It's been buzzing around for the last few weeks, and it's actually been around for a while. It's called proning. Proning refers to, it's a medical term referring to an anatomical position. There's supine, if you actually can pretend your hand is a bowl of cup of soup, it's a body being placed on its back. And then there's prone, which is placed on your stomach. The reason that's relevant now is in 2013, there was a study regarding patients with acute respiratory distress syndrome, which is relevant to what we're talking about here with COVID. And what they found is that patients that were placed in a prone position or on their stomachs tended to have better outcomes as far as their oxygen saturation and their ventilation. Remember, ventilation is breathing. I said all that to say what we're finding and is that in the hospitals is that the patients that are coming in with COVID-19 are faring better. Their oxygen saturation is going up when they're placed on their stomachs. It's an amazing phenomenon, but what's happening basically is that by laying on your back, the body squishes down on your lungs, and by flipping it over, it is allowing areas of the lung, I'm pointing to my back, areas of the lung to get ventilated or get oxygen that wouldn't normally do so just by weight of the gravity of the body on the lungs. The lungs are kind of located posteriorly or located closer here in your back. So it kind of makes sense that if you lay on your stomach, you're able to breathe in and out much better. I posted an article from CNN that explains it, and then there's a demonstration video from the New England Journal of Medicine showing how to place patients on their stomachs with the ventilator tube in place. So we will see. That study in 2013 was done on ventilated patients in the ICU. They're currently, like I told you, there's a lot of clinical trials going on right now, doing a study on outpatient treatments for periods of 2 hours and 4 hours to see whether or not how patients do that aren't on the ventilator, just with the nasal cannula, how much it helps them. I do know from an anecdotal personal experience, my friend that was in the hospital and who was a doctor that had oxygen in his nose said that when he was placed on his stomach, when he laid on his stomach, he could breathe a lot easier. Stay tuned. That's just a definition. I hope it's helpful. Remember to use the self-checker up there. Look for symptoms of dry cough, fever, shortness of breath. If you have any questions, let me know. I hope this helps. Have a good day. Breathe, check, step back. Now let's go do this. We got this. We got this.